Hello everyone, this is Medical Gateway, and in this part we're going to study regarding the basophils and mast cells. So what exactly is the function of basophils and mast cell? So in the allergic reactions, these basophils and the mast cells basically release a lot of chemical mediators like histamine, bradykinin, slow reacting substance of anaphylaxis. These all chemical mediators will basically cause the vasodilation, bronchoconstriction, chemotaxis, all those things which are related to the allergy. So you just have to remember one point, that these basophils and mast cells will release a lot of chemical mediators. But how they will release a lot of chemical mediators in response to allergen? That is what we are going to discuss now. So the first step is the allergen enters into the body. For instance, if some person is allergic to pollen or any other allergen exposure, so on first exposure, whenever there is the first exposure to the allergen, the B cells, the B lymphocytes are going to be converted into the plasma cells. And these plasma cells will result into the formation of the antibodies. So whenever the allergen comes, the B lymphocytes are going to be converted into the plasma cells, and those plasma cells will produce a lot of antibodies. And now these antibodies will go, and these antibodies will be attached to the mast cells and to the basophils. Okay? Now, these antibodies have done nothing to these mast cells and basophils. Okay, so this is the first story. Now, then there is a second exposure of the same allergen. This was the first exposure. Now, if the body faces the second exposure to the same allergen, now this allergen will go and will be attached to this combination of antibody and mast cell, and to this combination of antibody and basophil. Okay, so on the second exposure, this allergen is going to get attached to the combination of the antibody and mast cell and basophil. Okay, and whenever this allergen is attached to the antibody being attached to the mast cell and basophil, this will result into the degranulation of the mast cells and the basophils. Now, when the degranulation takes place, then a lot of the chemical mediators are released by the basophils and mast cells. Okay, and now these chemical mediators will basically cause the inflammation, will basically cause the allergic reaction. Okay, so on first exposure to the allergen, B lymphocytes will be converted into plasma cells. Plasma cells will produce antibodies. Those antibodies will be attached to mast cells and basophils, and nothing will happen. But if there is second exposure to the same allergen, that allergen is going to get attached to the combination of mast cells and basophils with antibodies. And whenever this takes place, this allergen is attached to the antibody on mast cell and basophil, it will result into degranulation of mast cells and basophils, releasing a lot of chemical mediators like histamine, bradykinin, and slow reacting substance of anaphylaxis. Now, if you focus on the functions of histamine and bradykinin, what histamine and bradykinin is causing? They both are causing the vasodilation and the bronchoconstriction. Both the histamine and bradykinin cause vasodilation and bronchoconstriction, whereas the slow reacting substance of anaphylaxis will cause, along with the vasodilation and bronchoconstriction, it will also cause chemotaxis. So histamine, bradykinin, and slow reacting substance of anaphylaxis, all of them are causing vasodilation and bronchoconstriction, vasodilation and bronchoconstriction, vasodilation and bronchoconstriction. But slow reacting substance of anaphylaxis are also causing chemotaxis. So basically they all have the same functions. Now, what bronchoconstriction does? Bronchoconstriction will give asthma-like feeling. Whenever there is constriction of the bronchioles, which is known as bronchoconstriction, the person feels difficulty in breathing, the symptoms of asthma. Whenever there is vasodilation because of the allergic reaction, this will result into decrease in blood pressure, fall of blood pressure. Okay? So in the allergic reactions, the person can feel bronchoconstriction and can feel difficulty in breathing, just like asthma, and the person can also feel lightheadedness because of the decreased blood pressure. And the person can also feel itching because of the chemotaxis. So these were the histamine, bradykinin, and slow-reacting substance of anaphylaxis. Now, along with them, heparin and serotonin are also released by the basophils and mast cells. So heparin and serotonin have anti-inflammatory effect. So these all are histamine, bradykinin, and slow-reacting substance of anaphylaxis that are pro-inflammatory, whereas heparin and serotonin are anti-inflammatory. Okay, so the same basophil and mast cells are releasing pro-inflammatory as well as the anti-inflammatory substances. These anti-inflammatory substances will keep a check on the pro-inflammatory substances. Okay, so that the whole process remains in balance. Okay, so this is the function of basophils and mast cells with the response to the allergic reactions. So this is it. See you in next part.